The next item under your general business, Mr. Chairman, is request board approval to amend the Director of Tourist Development Council's employment contract to provide access to health insurance coverage. You see the background there, but basically, Commissioners, a couple months ago, I had a conversation with the Executive Director of the TDC, who had sought out the ability to gain access to health care coverage through Capital Health Plan, the county's provider. Staff went to CHP. CHP basically clarified to us that as Ms. Portwood is a contract employee, that access to coverage needs to be laid out and detailed in her employment contract. We worked then on, simple language that would address that. What's being put forth tonight would have the county, from the same general fund account that covers most salaries, pick up the county's portion of this from June 1st through the rest of the fiscal year, if that's the board's desire to approve. We've been clear with Ms. Portwood, and I think the council understands that if this moves forward, if you approve it, in other words, that the county quote-unquote contribution in future fiscal years would have to come from their revenue source that supports their operations and truly Ms. Portwood's salary. And I haven't heard any concerns on that issue, but that's the background, that's the long and the short of it. It's a policy decision before you. We're here to answer any questions, and I do note that Ms. Portwood's here as well.
I move to approve amending the Director of the Tourist Development Council's employment contract to provide health insurance coverage at the same level as existing county employees.
Second. There's a motion by Commissioner Ott, second by Commissioner Brock, to amend the Director of Tourist Development Council's employment contract to provide access to health insurance coverage as other employees of the county. Larry C. Roberts.
Oh, it seems like over time I've been up here to talk about this on several occasions. I'd like to see the bed tax reduced to zero. There've been a lot of benefits to that. Our motels would be more competitive to the motels in Tallahassee and elsewhere. There'd be more people in those beds if they were more competitive price-wise, and a lot more money spent out in our community. My understanding of the way that it's set up, this is a perpetual motion type thing, that the money that you budget is money that comes from the bed tax that goes back into the Tourist Development Council, and none of it comes from the general fund. There's no expense to us taxpayer, if I understand that correctly. You mentioned this first portion, the remainder of the year, the general fund paying for Ms. Portwood's insurance. I think that was what the discussion was, and I disagree that that's. I disagree with that. If any money is paid, it should come from the Tourist Development Council money instead of the county. And while I'm talking on that subject, let me just briefly talk about rent. The Tourist Development Council has an office that is being rented out at Tallahassee Community College, I think. And I think that the Tourist Development Council should be paying any rent that for spaces they use. I find it particularly objectionable that the county pays rent while there's spaces available in that building, big building behind you across the road, that we could use for our county's office space. Thank you.
Thank you. Okay. Further board discussion?
If possible, because I know that Ms. Portwood's had to go without health insurance for a while, if we could expedite the process as much as possible. So if it can start sooner than June 1st, or if we have to process paperwork to make sure it starts June 1st. Because I know sometimes the health insurance, the paperwork, you put the paperwork in and it takes 2 months before it becomes active. So anything we can start as quickly as possible, I'd like to see us do as quickly as possible. I didn't see a date in here.
Okay, thank you. I have some comments and some questions. I don't know who I should address them to yourself, Mr. Henry? Okay. So who wrote the contract that we have in, the amended contract that's in our book right now?
The amendment, the addition of the line?
The amended contract that's before us.
Are you talking about the amended contract really, I think, only includes a clarifying statement. So are you talking about the contract itself that was approved a few months ago?
Well, I'm just asking, the document that's in my book, attachment 1,
Right. Well, I think
with 4 pages, I'm just asking who did it?
I think as far as the amended language, just adding the clarification line. Didn't your office review that?
Yes. I don't know who drafted the original contract.
And that's what I'm trying to get at.
What I'm asking is, I have a 4-page document here.
Right.
Pages 1, 2, 3, and 4. The last page says by Heather and Sinosa. And it has my name on it, and that's what's usual, and the Tourist Development Director's name and the Clerk of the Court's name. But the other 3 pages is the contract that we're being asked to.
Right. And what I'm saying, Mr. Chairman, is I think that contract was crafted by your prior county attorney, approved by a prior board. I believe it was updated in consult between Ms. DeBose and somebody on the Neighbors Guild firm to just add a clarifying line regarding the health insurance.
Okay, well, I'm just going to say that this document is not ready to be signed and that there are inconsistencies in it, okay? And it's my opinion, I'm not an attorney, but I've read it. And so I have a problem with the document. That's number 1. But more important, I have a problem with how this item moves forward to the board. And I certainly understand when someone that works for the county, that has difficulty in getting health coverage, I think we all want to try to make that available. But when we're looking now as setting maybe a precedent, are you recommending that we now provide health coverage to all part-time employees of the county?
No. This is a person that works for the county. You have 3 contract. You actually have 2 contract employees. Both, I think, are considered county employees. One is myself, and the other is Ms. Portwood. Now, my contract outlines health benefits. Ms. Portwood's did not. And that's the only thing in her contract document I'm bringing forward as an amendment.
Right, and what I'm saying, I guess, is as a precedent, you're not saying that part-time employees will be covered by the county, but this contract employee who is part-time, we should pick up the bill. And what I'm fearful of is general taxpayer dollars going in to fund this. I have no problem with the person paying their own way with this. I just think it potentially sets a bad precedent for us to open this Pandora's box. There's nothing. I laud the effect, the goal of opening that door for additional health coverage, but I don't like the door being open to part-time employees. But if that's what the board wants to do, that's what the board wants to do.
I think that it's important that we do this for the Tourist Development Director. TDC director. I also think that we should be, I've said this before in here, I think we should be looking, hopefully the TDC will recommend this year to raise the bed tax and help move that position into a full-time position so that we can encourage all of the tourists to come to Will County that we talk about, we try to build our economy off of. If we're going to talk about trying to have a green economy and an eco-tourist-based economy and a heritage-based economy, then we have to spend some money to try and get people down here to come spend their money here. And I think Pam is doing a great job of that. I don't think you're arguing that. I don't think you're arguing that at all. I'm just saying, I've been very proud of the work she's been doing. When I learned that we weren't providing her health insurance and that because of a pre-existing condition she was having problems getting it, I wanted to make sure we righted that as quickly as possible. We're going to be covering a few months worth of health insurance for her, and then it will come out of the TDC budget in the future, and I don't have any problem with that this year.
So what's the cost to the county?
I'd ask for that as well. The analysis that I see is that with an effective date of June 1st, and Commissioner Brock is right, it does take time sometimes. I mean, we're not going to, certainly wouldn't sit down if the board approves this, but with an effective date of June 1st, the board share through the rest of the fiscal year is just shy of $1,700. And then the estimated annual cost next year is just over $5,000, and that cost would be, and that's the board's cost, would be applied to the bed tax.
Can I ask a question here? Mr. Piggery, Pam is not a OPS employee.
No, she's not.
She's a contract employee that happens to work how many hours a week?
20, I believe.
Okay.
Well, paid for 20.
And that's how I differentiate between the two, is that I see where you're headed, Mr. Kessler, but I differentiate between the two by first, she's a contract employee. I mean, I'd vote tonight to bring her on full time, but I don't see any problem with this, especially that amount of money for the rest of this year.
Well, I do, and that's what makes life interesting. I laud the intention to open that door for our director to receive. I have a problem. You mentioned 20 hours. I don't see where in this contract it says 20 hours. I think that the contract is not a good contract. I think that it's not fair to Pam, it's not fair to this board. It's a very difficult contract to interpret. But I didn't mean to get into the contract tonight. But I probably would be voting against this if this is where the board goes. I think that the Tourist Development Board and their fees should be self-supporting, and that no general funds should flow in that direction. I think that's where I'm coming from. And that if an employee there wants to have health insurance, and we can help by writing that letter to Capital Health and saying, yeah, we want them to be considered part of our plan. I'll do that day in and day out. But I think I don't want to cross that line. I think it's bad. So, personal thing. So, no further discussion? Further discussion? Yes.
Mr. Administrator, do we have other employees that are working half-time or three-quarters time? Is this the only employee that we have that's part?
We have OPS employees, yes, sir. There is a difference between OPS employees and contract employees. So.
Okay. Call for the motion. All those in favor signify by saying aye.
Aye.
Opposed? Aye.